Hi, I'm Ryan. I'm at CMC's nursing lab in Breckenridge, and I'm going to do a comprehensive physical assessment on my patient today. Her initials are MB, and we may or may not change her date of birth for HIPAA reasons. I'm going to go ahead and scan the room just to show you everything we got in here. Mostly just showing you that I am not using any prompts or props aside from the props that are required. And my coffee mug, which is holding up my camera. All right, let's get started. Perfect. All right, so could you tell me your initials?
MB.
And could you just make sure you can actually see me as well? Could you tell me your date of birth?
1/12/94.
Okay, and we're verifying that. We've done hand hygiene. I'll put on gloves. Could you go ahead and tell me where you are right now?
I'm in Breckenridge.
And what's today's date?
November 2nd.
And what's the time?
About 11 o'clock.
This shows us that she's alert and oriented ×4. And we're going to continue with a neuro assessment. And this neuro assessment will also test cranial nerves as well. General appearance of our patient appears to be normal, no signs of distress. Her skin color looks normal, pink, warm, and dry for her ethnicity. And facial expression and her speech sounds clear and looks normal. And so real quick, we'll have you stand up, please, to do our Romberg test. Go ahead and back up just a smidge. Go ahead and put your arms over yourself like a sailor. I'm just protecting her from falling. Go ahead and close your eyes. A little swaying is normal. This test is normally done over 30 seconds. And you can open your eyes and you could take a seat. We're gonna expedite things to try to be within our 15-minute time frame. But I've been seeing her walk. We've already done a full Romberg test on her in the last video. We know that's normal. I would like you to follow my fingers with your eyes. Testing 6 cardinal fields of gaze, as well as accommodation. We're going to look at her eyes to fully assess Pearl or Perla. Look right at me. And I actually already saw her pupils are reactive, even just when she looked at me, but they are reactive to light. These are also part of our cranial nerves, the 6 cardinal fields of gaze, as well as the accommodation. Can you feel me touching your forehead?
Yes.
And your face?
Yes.
Can you puff out your cheeks? Can you relax and open and close your jaw and shrug your shoulders? Again, for our cranial nerves. I would like you to close one eye. I'd like you to look at me. Tell me how many fingers I'm holding.
3, 2, 2, 3, 1.
Good job. Other eye, please.
1, 2, 2, 1.
Go ahead and relax. Let's look in your eye, right at me. Look right at me, sorry. Looking for the white light in the middle of the eye. Looking really close. Sorry, it's gonna blind you a little bit. Looking for red light reflex, which I saw in both eyes. Saw the white light on both eyes. That's normal. We'd like to take a deeper look into all the veins and arteries of her eye, but this helps us with our neuro exam, what we've already performed. So we're going to continue to just look at her eyes real quick. I don't see any redness in the conjunctiva. Her eyelids look normal. There's no discharge. She's not relating any pain. We'll come back to looking at her mouth and her ears. Right now, I'd like you to close your eyes, stick out your arms like you're holding a pizza. Keep that up for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Go ahead and open your eyes. Put finger to nose with a straight elbow, and to my finger, and to nose. Do that to the other side. Perfect. You can relax. Go ahead and close your eyes. Lift one leg for 5 seconds. 5, 4, 3, 2, 1. Relax. Other side, please. 5, 4, 3, 2, 1. Relax. Can you put this heel on this shin all the way up to your knee and back down? Same thing on the other side, please. And back down and relax. You can open your eyes. Go ahead and close your eyes. I'd like you to hold out your right hand and just tell me what this object is.
Keys.
Okay, thank you. And you can open your eyes. I want to just explain this test. We're going to check for any sort of neglect on either side. We're also going to check that she can describe like soft or dull objects. So first, we're just going to show you what that feels like. We're using a pen for a sharp object. Does it feel sharp or dull?
Sharp.
And then finger?
Dull.
Okay, good. Perfect. So we're just going to do this on both sides and on one side kind of simultaneously with her eyes closed. Close your eyes, please. And first we'll, just tell me what you feel.
I feel both of them.
And is it sharp
It's
or dull?
sharp.
Okay.
Sharp on both sides. Sharp on my left side. Sharp on my right side. Dull on my right side.
Gonna touch your face.
Dull on both sides. Sharp on my left side. Dull on both sides. Dull on my right side. Dull on my left side. Dull on both sides. Dull on both sides. And sharp on both sides. And dull on both sides. Dull on my right side.
And you can relax and open your eyes. So she did good. I'd say she passed. There was one part where she said dull when it was sharp. I think if she was in a gown and not jeans, she probably would have noticed that. So we've done most of our neuro. We're going to continue and finish the rest. Let's have you squeeze my hands. Squeeze, squeeze, squeeze. Relax. I'm squeezing your hands. Do they feel numb?
No.
In your hands or your feet?
No.
Okay, perfect. We're feeling pulses. That's good on our radial pulses. Good cap refill. We're going to check pedal pulses and posterior tibial pulses. Those are nice and strong. I would say +1 in the lowers. So, not 100% strong, but definitely +2 in the uppers. And push down, pull up. Great. So that completes our neuro exam. We will do our reflexes next. So if you could swing your legs over here, and just to reiterate, that full head to toe neuro with the addition of the mouth assessment in a sec will complete most of our cranial nerves. All right, so first I'd like you to relax your hands like such. We're gonna do, I think it's called the brachial radialis nerve, right here towards the radial artery, but it's the tendon. And I believe I see her hand moving with that one. It is a little difficult for me to see. Now this is the bicep. Nice and relaxed, please. Perfect. And I did see her hand move. You can also feel the tendon move right here. I'm going to do that on the other side as well. And nice and relaxed. I'll try to not hit you so hard. Good. Nice and relaxed. Good. Seeing her fingers clench and feeling the tendon move right here. Go ahead and just relax your arm. We're going to do the tricep reflex. Just relax as best as you can. Okay. I think the first time we saw the reflex, let's try the other arm on the tricep reflex. Relax, please. Good. Okay, now we're going to do the quadricep reflex by hitting close to the patella. Nice and relaxed on your leg. Good. Good. We've done that. Let's check the Achilles reflex. And we're striking on the Achilles. I'm not sure. I know you can't see on the video, but that's what we're doing. Good. Good. And that's positive on both sides. Can you swing your legs back and relax in bed? Now we're checking for the Babinski reflex. This actually is not pertinent while she's totally conscious, but since you asked us to do it, we will. This would be more pertinent on a patient who has a GCS less than 8. She has a GCS of 15. Anyway, we'll just go ahead and do it. And we're going from the heel to the ball of the foot with our finger swiping up. You can open your eyes. And it's normal. There was no reflex. We don't want to see a reflex in adults. If there was a reflex, that would be a positive, I believe, plantar or definitely called Babinski reflex. It'd be a sign of a poor neurological injury, but she doesn't have that. Hard on a conscious person because they might be ticklish. So we're going to just go back to your face, just looking at your sinuses. We're going to check your hearing with a whisper test. Can you close your left ear or cover your
my right ear?
Left ear? I'm going to say some numbers. Please repeat them.
1, 2.
Cover your other ear.
3, 4.
Good. You can open your eyes. We're going to test your hearing. Tell me if you hear this.
Yes.
Good.
I can hear that.
And when you hear it, was it equal on both sides?
Yes.
Okay, perfect. I'm going to quickly continue to test your hearing. Good.
Yep, I can hear that. Yep. Yep.
Perfect. So the fact that it was equal on both sides in our first portion of her test, and that she could hear each side on our last portion of our test means she passed and was positive on all of our tests. We're going to quickly, we already looked at the eyes. We're going to go ahead and look at her nose. Well, I guess we'll do the ears first and then the nose. Grabbing an alcohol swab to not be gross. No, ears look intact. I'm going to try not to pull so hard. She said it kind of hurt last time. I'm able to see her eardrum, see a reasonable amount of earwax, which is normal. Looking at the ear, looking at her eardrum and ear canal, no lesions, no blood, a fair bit of earwax, pretty normal. Able to see some hairs in her ear. So she's not smelling alcohol, even though that's safe. I'm just gonna let that air dry on her lap for a moment. Real quick, gonna do a quick head to toe palpating her musculoskeletal. Shoulders are equal. Go ahead and sit up, please. Chest and back feel equal, and her rib cage feels equal. Her arms, relax. Her hips, femur. Oh, the bed moved, even though it's locked. Tibia and lower leg, which would also include the fibula and her ankles. That all feels normal. Does it hurt at all?
No.
Good. Let's go ahead and look at your nose, listen to your heart and lungs and belly and back lungs, and then continue. All right, so just looking at the nose real quick, trying to make sure there's no deviated septum. I don't see that. Looks good on both sides. Able to see that there's no blood or lesions or swelling, so that's good. All right, now let's listen to our breath sounds. We're going to listen to the 2 lobes on the left as well as the 3 lobes on the right. Big breath, good. Big breath, good. And a few more big breaths. Can you lift your arm a little bit? Big breath. Go ahead and lean forward. A little harder to hear the lower lobes, but I would say she sounds pretty clear. And relax, and nice and clear on the back. You can breathe normally. I'm listening to your heart. I hear a good S1 sound. Correlating with the radial pulse. Counting, she's about 64 beats a minute with our apical pulse, which is auscultated at her heart. We could check all 5 heart tones, and if I heard a murmur or any issues, I would go ahead and do that, but for today's reasons, we won't. I'm gonna palpate your carotid artery. Okay. And I was gonna reach across you. I am reaching across you, just fair warning. And I can feel her carotid artery on both sides. Can listen. I don't hear any swishing sound, which could be a sign of a dissection. Her trachea is in line. It's not deviated to one side or the other. I don't see any distended jugular veins. I'm gonna feel the thyroid, and I'm feeling your lymph nodes as well. I'm not feeling any swelling there. I'd also like to look at your mouth. Her mouth is pretty easy to see. I'd like you to stick out your tongue. Say ah. Stick out your tongue. Perfect. I can see the uvula. I can have you lift your tongue so I can see your buccal mucosa. Her teeth, her lips, they're all intact. Stick out your tongue. Okay, we can stop. She does have a gag reflex. She doesn't like this wooden spoon being, or tongue blade being back there. That's part of cranial nerves as well. I would like to ask you if you've been smelling.
Yes.
You have a sense of smell, sense of taste.
Yes.
No loss of sense of smell.
No loss.
Okay, most literature nowadays says we can just ask our patients if that's been normal to test that cranial nerve. We could also hold like cinnamon or coffee up to her and make sure she can smell that. And if she had a head injury, I would go ahead and do that, say like if this was a revisit for a year later. But since she hasn't had any issues, that's adequate. Let's listen to your belly. Listening for bowel sounds, and I can hear them, they're active. If they weren't active, I'd listen for 60 seconds to call them absent or hypoactive, but they are active. Any pain when I press on your belly?
No.
Her belly's soft and non-tender. I have active bowel sounds. Or she has active bowel sounds. Have you had any issues peeing or going number 2?
No.
No blood in your stool or blood in your urine?
No.
So I would say that's a normal GI assessment. Do you have any medical concerns right now?
No.
Okay. Do you go to the doctor regularly?
Yes.
And we did do a full review of health on a previous assessment, and so that's already been done. We want to just check her skin color and her other extremities. We did already do that when we were looking for pulses, and her skin color looks normal. We've completed our cranial nerve assessment with our full head to toe. I'll give deeper details on that later. And I'm just thinking out loud that we checked your eyes, we checked your ears, your mouth, and your nose. We checked pulses, actually palpated head to toe, and did a pretty extensive neuro assessment. And since she's been talking to me throughout this time, I've been assessing her speech, which is clear. If there were more concerns, we could do a full stroke assessment for like dysarthria or aphasia, but I haven't seen any concerns with that. So I believe this concludes our assessment, and thank you for your time.
Thank you.
And we would wash our hands.